Well, China is pursuing an ambitious program of reform to improve the public health care system, and the government has been conducting this medical reform for over a decade. And now we continue our special series to look at those efforts and achievements and the challenges ahead. Nearly half of Shanghai's residents have signed up to a tiered medical care system. They now have access to a family doctor, a district-level hospital, and also a city-level hospital. Our Shanghai correspondent Shi Wenjing takes a closer look.
Today is a weekend, but this medical service center is still busy. Many residents who live nearby come here to see doctors and get their medicine. 62-year-old Mr. Gong suffers from cardiovascular disease. He needs to take medicine long-term to keep fit after surgery. He chooses to visit the medical service center nearby rather than the city-level hospital.
It usually takes me half an hour just to go to the big hospital, let alone the waiting time. Sometimes it's hard to get a ticket. Now I only need 5 minutes to see the doctors here. I can get all the prescription medicine from my family doctor. She can help me register and get tickets at the big hospital, because family doctors enjoy this privilege.
Dr. Yang is a family doctor in this community. Apart from taking care of patients who are able to see her in person, she also uses her lunch break to look after those who find it inconvenient to come to the center. To encourage more people to join the scheme, Shanghai launched reforms of the tiered medical care pilot project. According to the plan, the city's medical service center is divided into 3 categories depending on their distance. Each category will have a bonus of 6,000, 4,000, and 2,000 yuan accordingly based on the valuations, such as workload and feedback from patients. This made the position a lot more attractive to doctors. Dr. Lin Hui has trained as a general practitioner for the past 6 years. She can choose either to stay in medical service center or to apply for district or city-level hospital, but she chose to stay in this medical center in the town.
The new policy is very encouraging. Our medical service center is far away from the city, so it listed in category A, which means if we work well, we can have 6,000 yuan bonus each month. It is 70,000 yuan more than before. It is not only about money, I think it is about a confirmation of our past work. It is very encouraging.
In order to relieve hospital crowding, the family doctor program was set up to encourage patients to choose between going to a hospital for their initial diagnosis or visiting their regular family doctor. It's part of the efforts to push the tiered medical care project. Based on the official figures last year, community-level medical centers across the city provided nearly 8,500 medical services. 57% of the elderly people aged above 60 choose to see doctors in the community medical centers.
We have 2 goals of this new round of a medical reform among communities. First, we want to make the family doctor system become a more comprehensive one. Second, with a solid family doctor system, we'll be able to push forward our tiered medical care project.
So far, there are 5,000 general practitioners like Dr. Lin Hui across Shanghai's remote communities. The city plans to equip all of its 240 community health centers with family doctors by the end of this year, and to require all of its residents to sign up with them by 2020. Shi Wenjing, CCTV, Shanghai.